The Centers for Medicare and Medicaid Services, also known as CMS, released 2022 premiums, deductibles, and other information for Medicare Part D prescription drug plans. In this video, we'll go through that information and talk about what it means for you. Hi, I'm Tabitha Moldenhauer, broker with Benefit Consultants Midwest. If you haven't already, please take a moment to hit the subscribe button. We have new, helpful Medicare content every week. First, what is the information released by CMS? It doesn't tell you what your particular plan's premium, deductible, or any other costs will be. What CMS put out is the Defined Standard Benefit Plan. To be approved for sale to the public, all Part D coverage must be at least as good as the Defined Standard Benefit Plan. The Defined Standard Benefit Plan is the lowest level of coverage that CMS will allow to be sold in any given year. For 2022, here are the cost-sharing amounts for the Defined Standard Benefit Plan and the changes for each from 2021. Average monthly premium, $33. In 2021, it was $31.47. Deductible, $480. In 2021, it was $445. If your plan has a deductible, you pay the cost to fill all your prescriptions until you meet this amount. Initial coverage limit, $4,430. In 2021, it was $4,130. Once the deductible is met, the plan will pay a portion of your prescription costs, and you may have coinsurance or copayment amounts of up to 25% of the cost to fill your prescription. The total cost of your prescriptions is tracked by the plan. The cost sharing remains at the initial coverage levels until total prescription costs meet the initial coverage limit. If your medication costs reach the initial coverage limit during the calendar year, you will move into the coverage gap or donut hole phase of coverage. This used to be a very stressful topic when discussing Part D plans. Formerly, you would be responsible for all medication costs in the donut hole. That has changed. Now you continue paying a limit of up to 25% of the cost for your medications, just like the initial coverage, and the balance of the cost is shared between your Part D plan and the drug manufacturer. Catastrophic coverage. If your out-of-pocket costs reach $7,050, you will move into catastrophic coverage. In 2021, this occurred at $6,550. If you reach catastrophic coverage, you will pay either 5% or a copay of $3.95 for a generic medication and a $9.85 copay for brand name medication. Your Part D plan covers all other costs to fill your prescription medications. So what does all this mean for you? The information released by CMS doesn't tell you what your prescription medications are going to cost with your plan, but it does give you a picture of the worst case scenario for the upcoming year, since all plans have to be at least as good as the Defined Standard Benefit Plan. It's worth a few minutes every year to see how cost sharing is changing in a big picture sense for Medicare Part D plans, but there's no need to spend a lot of time with it. Your time is better spent looking at the options available to you in your zip code for the new plan year. When you look at those plan options, it's important to have your information, your prescriptions, and your pharmacies included rather than just looking at the plan's cost sharing and designs. A Medicare Part D plan design is not useful until you know how much that plan will cost for your medications. A Medicare plan broker can help you sift through all the information to figure out which plan is really the best one for you for the new plan year. If you have questions about your Medicare Part D coverage, please feel free to give our office a call at 877-312-1414 or visit bcmwi.com. We're here to help you understand your options and find the best Medicare coverage for you. Have a great day.